Hi, this is Dr. Mary Kathleen Figueroa. Thanks for coming to my thyroid channel. If this is your first time, please remember this is for educational purposes. If you have specific medical complaints, please discuss them with a local endocrinologist. Today we'll be discussing the 5 important tests for hypothyroidism and for Hashimoto's thyroiditis. We'll start with reverse T3 because it's very popular on the internet, and it is a test that's relatively unused by endocrinologists and almost exclusively used by alternative practitioners, which is really interesting if you think about it. So reverse T3 is what happens when you take T4 and there's a machine inside every cell that has a nucleus that will make either active T3 or reverse T3. The T3 deiodinase makes reverse T3. This reverse T3 has no known use in the body, and it is really an inactivating hormone. And in fact, we have plenty of phosphatases and other inactivating hormones in the body that make a certain protein less usable. So it is mostly seen in people who are critically ill or who are very infected or otherwise not doing well clinically. And so the reasons for it and what we can do about it are not well understood. And so since I can't do much about it as an endocrinologist, I don't often test it. But patients come to me often with high reverse T3s telling me that they've been told for that reason they need T3 therapy. And then I have to tell them that we can't change the underlying mechanism that causes the elevation in reverse T3 by treating reverse T3. We have to change whatever it is that's causing it, such as infection and inflammation. So I rarely check reverse T3, and it turns out it does very little to help me make a person feel better. The second test is thyroid stimulating hormone. This test is what I use all the time. And this test is a measure of what the pituitary thinks your thyroid levels are. You can think of it as your thermostat. If it is cold, your thermostat needs to be turned up and you'll get a high TSH. So if you have very low thyroid levels, you'll have very high TSH. And if you have hyperthyroidism, the opposite condition, you'll have very low TSH as your body tries to turn down the thermostat of the room of your body. So thyroid stimulating hormone, if it is high, is a sign of hypothyroidism. Now, thyroid stimulating hormone is pretty steady. It's kind of like the Titanic. And while free T4, the next test I'll discuss, is kind of like a bit of a speedboat. So if you measure a TSH when everything is steady, then you have an idea what's been going on in the body for a good 3-4 week period. And it takes 3 or 4 weeks generally for the TSH to change significantly in a person with changing thyroid status. The next test is free T4. So free meaning not bound to albumin or any other hormones. So free T4 is a sign of how much active or thyroid hormone there is in your blood that isn't bound to protein. So if you're taking levothyroxine, it kind of measures how much levothyroxine there is in your body. If you are not on any medications, then it is a measure of what your innate thyroid gland is producing. And now the next test, free T3, is even more crucial because that is what's the active thyroid hormone in your blood. That is very much like a speedboat and is changing with a half-life of maybe 3 to 4 hours, just like reverse T3. So that tells you more about how recently, how much active thyroid that is able to do the things we're talking about, like make ATP in cells, is in your blood. The next test is a TPO antibody. So antibodies are related to inflammation and related to autoimmunity. And since Hashimoto's thyroiditis is due to autoimmunity, often a person with hypothyroidism will have high TPO antibodies. There are other antibodies to check like thyroglobulin and thyroid-stimulating immunoglobulin. But the ones that's specific for Hashimoto's thyroiditis and hypothyroidism is thyroid peroxidase antibody, TPO antibody. And that antibody can be both positive and negative because the TPO antibody can be positive if a person has active thyroiditis, they have a lot of thyroid cells, they have inflammation of the thyroid may even be tender. But later on in disease, when the thyroid has mostly shrunken and is scarred, and there's not that many active thyroid cells yet, you may have a negative antibody. And the analogy I'd make is that people with type 1 diabetes often have anti-antibodies to their pancreas, to their beta cells, that then over time will abate because they have so few cells left in their body that produce insulin. So we have discussed 5 important tests for hypothyroidism. They are reverse T3, TSH, free T4, free T3, and TPO antibody. Of those, I think the most important and the one that's stable and easy to measure from one lab to another would be the TSH. But I think too, depending on the kind of therapy you're on, you may need to have the entire panel measured. If you're on T3 therapy, then probably someone should measure how your T3 levels are on that therapy to make sure it's not too high and then predisposing you to problems with palpitations and problems with bone loss, and to make sure it's not too low, since that's the point of the therapy. So I hope you enjoyed this video. If you like it, please give it a thumbs up. If you'd like to subscribe, please subscribe below. And I look forward to seeing you again. New videos every Friday.